Welcome to the Duke Minimally Invasive and Bariatric Surgery Fellowship. I'm Kunor Jane Spangler, the Program Director. Dr. Jin Yu is our Associate Program Director. We are very sorry that we couldn't meet you in person this year, but we look forward to our virtual interviews and hope that this presentation gives you a little bit of an overview of our program. We hope to make our fellowship the best in the world when it comes to both minimally invasive surgery and bariatric surgery. Our teaching philosophy is based on graded autonomy, general training, and tailored training. By graded autonomy, this means that over a short period of time, fellows learn each case step by step. Within a few cases, they start doing these steps themselves, and within a few months, we expect them to be able to operate independently doing all of our cases. Our general, MIS, and bariatric training includes a lot of bread and butter general and bariatric surgery, as well as a high volume of complex revisional bariatric cases. Most of the bread and butter general surgery are cases that we expect our fellows to be doing independently from the beginning of the year. The primary bariatric cases are being done by fellows early in the year, and the complex revisions are also done by the fellows once the primary operations have been mastered. Tailored training occurs towards the end of the year. Once jobs are secured, we start working with fellows on the techniques that they are going to take out into their own personal practices. There are 6 surgeons in our division, including myself, Dr. Sudan, Dr. Portenier, Dr. Seymour, Dr. Yu, and Dr. Garon. There are 3 clinical fellows, and therefore we have 3 apprentice-type rotations. One of them is with Dr. Portenier and Dr. Sudan, another is with myself and Dr. Garon, and the last is with Dr. Seymour and Dr. Yu. Each fellow spends 1 month at a time on a rotation, and we cycle throughout the year. Currently, our fellows rotate at 2 or 3 different hospitals, but this does remain in flux over the years. Duke Regional Hospital is our bariatric center of excellence and is the hospital where we do the majority of our cases. Main Duke Hospital is where the fellows have currently spent 1 month of the year doing an HPB rotation. This may or may not occur in the future. Duke Raleigh Hospital is a hospital in Raleigh about 25 minutes away from Duke Regional Hospital. A couple of our surgeons do general surgery cases there, and the fellows occasionally rotate out there. The fellows also see consults at Duke Raleigh Hospital when needed. Alamance Regional Hospital is a hospital west of Durham, about 30 minutes away, where we are starting a bariatric practice, and the fellows may or may not rotate there in the future. Our operating rooms are equipped with state-of-the-art laparoscopic and robotic equipment. One of the upsides of being at Duke is that we often have access to newer technologies before they're out on the mainstream market. We do about 3 to 8 cases per day, depending on the surgeon and the time of year. As you can see from the case volume handout that's been provided to you, our fellows on average get between 400 and 600 cases a year. This tends to be a pretty good mix of general surgery, including gallbladders, foregut, simple hernia, and complex abdominal wall. In addition, you can see that we have a very high bariatric case volume, so our fellows are well above the required numbers. In addition, we have a pretty robust advanced endoscopic practice, including suturing, dilations, stenting, peroral pyloromyotomies or POPs, and endoscopic fenestrations. Our fellows are in clinic about 1 or 2 days a week. The clinic is located a couple blocks from Duke Regional Hospital, which makes it pretty convenient for rounding and consult purposes. The fellows do have their own office in the clinic. There are about 10 large exam rooms, which are good for our bariatric patients, and there are 2 different conference rooms that we use, one for group visits and one for seminars. We have a robust research program that is led by Dr. Garon and Dr. Seymour. There are multiple active clinical and basic science projects, and at orientation, the clinical fellows, research coordinator, Dr. Seymour, and Dr. Garon will go over the list of current projects. Normally, one of the research fellows and one of the clinical fellows will pair up on a project and work together with the attending leading the project. It is our expectation that all clinical fellows submit at least 1 abstract or video during the year, with the hope of a presentation or manuscript at the end. Teaching conferences include the first Friday of every month, as well as every Tuesday morning at Duke Regional Hospital and every Wednesday morning at Maine Duke Hospital. Our first Friday conferences are dedicated to fellow teaching. The morning begins with the Innovations in Surgery video conference, which is a monthly video conference covering general and bariatric surgery topics. This is followed by our MBS AQIP meeting and then 3 hours of teaching solely dedicated to the fellows. During this time, we cover all of the curriculum from the Fellowship Council and ASMBS for certification for both MIS and bariatric surgery fellowships. After this, we have a research conference, and then the fellows are free in the afternoon to get work done. Every Tuesday morning, there is a conference from 6:30 to 7:15 a.m. that is the General, Vascular, and Bariatric Surgery Morbidity and Mortality Conference specific to Duke Regional Hospital. The fellows are expected to attend this conference and present if needed. Every Wednesday morning, there is Grand Rounds in Morbidity and Mortality at Maine Duke Hospital that the fellows can attend if they are free at that time. At Duke, you will have the opportunity to participate in numerous courses. Our division runs several courses, including a mini fellowship course for surgeons interested in learning how to do sleeves and gastric bypasses. We also run duodenal switch courses and revisional surgery courses that you will have an opportunity to participate in. There are other Duke courses that you can attend, as well as non-Duke courses, such as industry courses, that you can attend if you would like, as long as you have an appropriate number of days off. We believe courses are important, not just for developing and displaying your skills, but also for networking purposes. Surgeons from around the country come to these courses, and they're a great opportunity to reach out to them about future potential jobs. In our program, there is always one attending on call for bariatric surgery across the Duke Health system. In addition, there may or may not be opportunities for general surgery ER call for both attendings and fellows. General surgery call is sometimes paid and sometimes unpaid. Fellows take bariatric fellow call and cover 24/7 between all 3 fellows. This can be split up week by week or day by day. It is my preference to leave this up to the fellows to figure out for themselves. Toward the end of the year, you will be credentialed and privileged in bariatric surgery and will have the opportunity to take attending bariatric call on your own as well. On the floor, we have a PA named Katie Williams who helps with floor work as well as consults in the ER. All consults should be staffed either by Katie or a fellow with the attending physician on call or the attending physician to whom the patient belongs if they are available. We do have interns that cover the floor at night and on the weekends, and we are getting ready to hire a second PA as well. During the fellowship year, clinical fellows are given 15 days off. These days can be used for job interviews, written or oral boards, and vacation. National conferences that you are presenting at do not count as days off. If you'd like to attend other conferences where you are not presenting, then days off will need to be used. Holidays, when you are not on call, do not count as days off. We hope this overview has been informative and helpful, and can't wait to, quote unquote, meet you soon.